fifth thing that I learned is that some strength exercises are more effective than others at improving diabetes risk factors. Like I mentioned earlier, the majority of the strength exercises in your program should be multi-joint exercises, like push-ups or like a leg press. There are 7 different movement patterns that should be included in a strength training program, and I'm going to give you examples of mainly multi-joint exercises from each category that can be incorporated into your home strength training routine. The first movement pattern is a knee movement, and so this is going to include any variation of a squat or a lunge. Second movement pattern is vertical push, and this is going to be exercises like a dumbbell press or a banded overhead press. Third movement pattern is a hip movement, and this is going to include most deadlift variations like a kettlebell deadlift or a banded sumo deadlift. Fourth movement pattern is going to be a vertical pull, and so you can do banded lat pull downs for this category. Fifth movement pattern is a horizontal push, and so this is going to be like a dumbbell floor press or a push-up. Sixth movement pattern, this is going to be a horizontal pull, so this is different types of rows like a dumbbell row or a banded row. And the last movement pattern is a torso movement, so these are things like sit-ups or abdominal crunches. The sixth thing that I learned is that walking is one of the simplest ways to lower blood sugar. In people with type 2 diabetes, walking is the most popular form of exercise because it's relatively low impact and safe. You can change it up by the speed or the incline, and it doesn't require any specialized skills. In type 2 diabetes, one walking session can lower blood sugar, it can boost mood and feelings of well-being, and it can also improve arterial stiffness, which is related to heart health. Even though blood sugar can be improved through one 40-minute walking session at a moderate intensity, and this includes a warm-up and a cool-down, blood sugar can be improved more substantially when doing high-intensity interval training, or HIIT. A walking HIIT program could look like this: 5 minutes of a warm-up, and then alternate 3 minutes of high-intensity walking with 3 minutes of low-intensity walking, and do this for 30 minutes, and then finish up with a 5-minute cool-down. In people with diabetes, if you're wanting to start exercising at a higher intensity, so doing HIIT training, you first need to make sure that you've already been exercising for the last few months at moderate intensities on a regular basis and that you've been cleared by your doctor to do so. If you want to help stay motivated and support the channel, please take a look at the merch link down in the description.